Hello and welcome to the Abdominal Anatomy audio lecture. This PowerPoint will discuss all the anatomy of the abdomen. However, you should know that the most common image that we take of the abdomen is an anterior-posterior or AP supine abdomen. And we call that a KUB for short, which stands for kidneys, ureters, and bladder. Even though that's the most common image we take, we still want you to be familiar with all of the abdominal anatomy, so that's what we'll discuss here. First, let's talk about the muscles found in the abdominal cavity. The three that are most important in abdominal radiography are the diaphragm and the right and left psoas major. The diaphragm, as you know, is an umbrella-shaped muscle that separates the abdominal cavity from the thoracic cavity. The diaphragm must be perfectly motionless during radiography of either the abdomen or the chest to prevent motion on our images. And you can prevent motion of the patient's diaphragm with clear and concise breathing instructions to your patient. The two psoas major muscles are located on either side of the lumbar spine. So you can see the right is here, and here is the left, and again here they are on X-ray. The lateral border of the psoas muscles should be faintly visible on a diagnostic abdominal radiograph of a small to average size patient when correct techniques are used. So let's take a close-up look here of our psoas muscles. You can see the black arrows here are pointing to the margins of those muscles. This band here would be your right psoas muscle, and this would be your left. And again, depending on the size of your patient and what is the contents of their intestines, you should be able to see the psoas muscles on most patients. And we'll take a look at examples in lab. Okay, we will talk briefly here about the various organs found within the abdominal pelvic cavity during this lecture, as I said, but I want to begin by discussing the digestive organs. The digestive system within the abdominal pelvic cavity consists of the stomach, the small intestine, and the large intestine. And interestingly, you may already know this, the adult GI tract is approximately 20 to 40 feet in length, which is crazy. The digestive system, along with its accessory organs, the liver, the gallbladder, and the pancreas, take up most of the space in the abdominal cavity. The pancreas is located posterior or behind the stomach and is not well visualized on this drawing. You can see the little yellow here and kind of the outline of it behind the stomach. That is the pancreas. The spleen, which is part of the lymphatic system, is also partially visible in the upper left abdomen posterior to the stomach. And so the spleen would be this purple here. Total, there are 6 organs of the digestive system. You can see them on our drawing here. Number 1 is the oral cavity. Number 2 is the pharynx. 3 is the esophagus. 4, stomach. 5, small intestine. And number 6, large intestine. And just remember that the oral cavity, or mouth, and the pharynx are common to the respiratory system and the digestive system, which we talked about in the previous unit. The esophagus, remember, is located in the mediastinum of the thoracic cavity. Okay, so let's begin by talking about the 3 digestive organs found within the abdominal cavity. And those are the stomach and the small and large intestines. So we'll talk about the stomach and the small intestines first, and then we'll finish with the large intestine. The stomach is the first organ of the digestive system that is located within the abdominal pelvic cavity. And as you know, the stomach is an expandable organ for the temporary storage of swallowed foods and fluids. The size and shape of the stomach vary depending on the volume of its contents, so how much is in the stomach can affect its size, and on the patient's body habitus. Gastro is a common word you may hear which refers to the stomach, and actually the Greek word gaster means stomach. The term gastrointestinal tract or GI tract describes the entire digestive system, starting with the stomach and continuing through the small and large intestines. The small intestine continues from the stomach as a long tube-like structure about 15 to 18 feet in length. The small intestine is further divided into 3 parts, which we'll discuss now. The duodenum is the first portion of the small intestine. It is the shortest but widest in diameter of the 3 segments, which it makes sense that it's the widest because when the stomach contents empty into the duodenum, they're not fully digested yet. So a wider tube makes sense. The duodenum is about 10 inches in length, and if you put contrast in the duodenum, you would notice it is shaped like the letter C. The proximal portion of the duodenum is called the duodenal bulb or cap, and you can see that here. It is well visualized on studies where the patient ingests barium, and we'll look at that in just a second. Ducts from the liver, the gallbladder, and the pancreas drain into the duodenum and aid in digestion, and we'll study that in a lot more detail next semester. The remainder of the small intestine lies in the central and lower part of the abdomen. The first 2/5 after the duodenum is the jejunum, and the last 3/5 is called the ileum. So let's be clear about that. When we're discussing 2/5 and 3/5, well, if we do the math, that equals 5/5, right? Well, when we measure the intestine like that, we are not including the duodenum in our measurement, even though the duodenum is it is the first part of the small intestine. So just to be clear about that. The valve that separates the small intestine from the large intestine is called the ileocecal valve, and that occurs at the end of the ileum and the beginning of the large intestine. Ileocecal valve. Let's take a look here at an x-ray of the abdomen with contrast. This patient has ingested barium, which shows up white on our radiographs. A is that C loop of the duodenum that we were talking about a minute ago, and then of course your duodenal bulb is right above that. B is the region of the jejunum, and notice it has a feathery appearance that is very characteristic of the jejunum. And then C is the ileum. And remember, at the terminal ileum, or the end of the ileum, you have the ileocecal valve, and that valve separates the small intestine from the large intestine. Okay, let's talk about the 6th and last organ of digestion, the large intestine. So the large intestine begins in the right lower quadrant of the abdomen at the junction with the small intestine and that ileocecal valve that we mentioned in the last slide. The portion of the large intestine that sits below the ileocecal valve is called the cecum. So here you can see ileocecal valve right here. So it's the terminal end of the ileum and the region of the cecum. And then all of this large intestine below that valve is the cecum. The appendix is actually attached to the posterior and medial aspect of the cecum, so kind of behind and pointing medially. The vertical portion of the large intestine above the cecum is called the ascending colon. So here is cecum, and then of course going up is your ascending colon. The ascending colon joins the transverse colon. So here's your transverse right here. They join at the right colic flexure. So right here, colic referring to colon. The transverse colon joins the descending colon, which is here, at the left colic flexure. And alternative names for the two colic flexures are hepatic, referring to the side with the liver, and splenic, referring to the side with the spleen. The descending colon continues as the S-shaped sigmoid colon, which you can kind of see here, and the lower left quadrant of the abdomen. The rectum is the final 6 inches of the large intestine. The rectum ends at the anus, which is the sphincter muscle at the terminal opening of the large intestine. And remember, terminal just means the end of. One thing to note, the shape and the location of the large intestine vary greatly depending on body habitus. And when you look at x-rays, the transverse colon rarely sits nice and transverse like this. It's often hanging kind of low and kind of swoopy here. But hypersthenic patients are going to have characteristically a more high transverse colon, whereas slender or hyposthenic or asthenic patients, usually the transverse colon is lower. Okay, we are going to pause here and we'll continue in part 2 with accessory organs of digestion.